It's a beautiful spring day, and we're going to meet two species of cedar. This is Thuja plicata, this is Thuja occidentalis. Put them really close together, you can see the similarities and the difference, but they're used the same. This is cedar, or Thuja, and it's a great medicine for cancer. It's used to inhibit mitosis, to slow down the rate of cell replication. I write about that in my book, Holistic Cancer Care, but this is an old medicine. This is a well-known medicine for inhibiting abnormal growths, skin tags, little polyps and such like. Also antiviral. It's the spring tips that are used for medicine. And where I live in the Pacific Northwest, this is a really sacred tree to the native peoples of this area. They actually call it the grandmother tree because they took medicine from it. Yes, the tips, they would steam it to get cleansing the air if there was infection and so on, using it in the sweat lodge, in ceremony, even in smudge sticks to purify the air, but also beating off or taking off the bark and beating it down and soaking it and beating it to get fibers out, so even making clothing from it, the grandmother tree. But more recently called the mother tree by Suzanne Simard at the University of British Columbia, who discovered how this tree, when it gets big, makes more sugar than it needs, and it can feed that out into adjacent seedlings, not even its own babies. Other species even are interwoven through the mycelial web underground in the soil, so that the big cedar can feed out into its neighborhood all its excess sugar. So truly the mother tree in the forest. A sacred tree to the Indigenous peoples, a sacred medicine, and also a very contemporary medicine for cancer used to inhibit abnormal cell growth.